Next type is corona. So corona is a broad category of positive single-stranded RNA viruses, and having infectious, they are very much infectious and enveloped viruses. That's why we can use sanitizers or alcohol-based sanitizers to eradicate this virus, or to kill this virus. So coronavirus is this. So in the corona we have the common cold, number two most common, second most common cause of common cold, and also there is a SARS, severe acute respiratory syndrome, COVID-19, and also there is a MERS. So SARS, COVID-19. How? Mode of transmission: respiratory droplet and aerosols. When it goes into the body, its course varies. Sometimes it is asymptomatic, and sometimes there is a common symptoms like fever, shortness of breath, and fatigue, and also fever, shortness of breath, fatigue, and dry cough. And the specific symptoms are anosmia, loss of smell, and abnormal geusia, loss of taste sensations. And how coronavirus goes into the host cell. Coronavirus use the ACE, angiotensin converting enzyme 2 receptor, which is normally present in the body and regulate our blood pressure receptor, and bind with its S protein or spike protein, and get entry into the host cell, and it is a positive single-stranded virus causing infection. So what are the risk factors? So risk factor is old age, diabetic patient, obese, weight gain or hypertension, and also severe cardiopulmonary illnesses. So what are the complications if you not treat the patient? So the complication is respiratory failure, multiple organ damages, organ failure, and also there is the patient undergoes shock, organ failure, shock, and also hypercoagulability and death. So how to diagnose? We use reverse transcripted PCR serology, and also PCR, and also we use antigen antibody testing. And treatment is pretty much supportive in quarantine, and also generally supportive of 14 days quarantine. But if the patient is critically ill, then we hospitalized the adult patients and give them remdesivir, convalescent plasma infusions, and also steroids for cytokine inhibition. So this is all about the coronavirus, how it causes infection in the body, how it is its specific and non-specific symptoms, specific and non-specific symptoms, and its course variation, and also its receptor binding.